Okay, so we're going to start by asking the audience. I have nine people on right now, hoping to get more. But what do you think? If you can just give me one thing, I just want one thing. What do you think is a benefit of exercise? I'm going to just call a name and you just give me one thing. Dion, can you tell me a benefit of exercise, please?
Sure, to keep the body relaxed, um, healthy, strong.
Correct. So, all right, we'll take that. I'll take that. Um, Letitia,
Hello.
yes,
It I feel that the benefit of exercise, it improves your um mobility, your functions. So you
yeah,
won't your joints won't stiffen up
yeah,
if you do exercise. Um it
yeah,
improves your breathing, your lungs
yeah,
and
a
your
whole lot
breathing.
of that. Yeah, absolutely right. But I'm going to tell you that there's like 50 different benefits, and I'm going to hit on a few of these. You guys are going to be a little bit surprised, but exercise, the chronic conditions we treat is hypertension, diabetes, high cholesterol, heart disease. Exercise is good for all of them. Obesity, exercise helps to burn calories so you lose weight, right? So let's go through this. My most important one is the immune system. People who are athletic, people who exercise, have better immune system because they're typically healthier people. We go back to COVID again. Who were the people who were dying from COVID mostly? Were people with comorbidities. Their immune function goes down. Exercise improves your immune system. It helps you to lose weight. It reduces your risk of the nation's number one killer, which is heart disease. And if you're athletic, if you exercise and you've had a problem, you have a better survival rate from a heart attack. Somebody mentioned about their posture and the strength. Exercise improves the strength in the spinal muscles. It improves your memory. How many people knew that? Anything that's going to improve your circulation is going to improve your memory, more blood flow to the brain, more synapses in the brain. You can bring nutrients to the brain better. It improves the body's ability to use fat for energy during physical activity. Growth hormone is a hormone of youth. When you exercise, you increase your growth hormone. People who don't exercise, their growth hormone stays stagnant. Growth hormone helps with your memory. Growth hormone helps with your physical muscle growth and bone growth. So by exercising, you're increasing your growth hormone. Now, nobody mentioned about the mental aspect to exercise, but it relieves stress, it relieves anxiety, because when you exercise, you're releasing endorphins. Endorphins are chemicals in the body that are produced after a good workout. It makes you feel good. It increases the oxygen uptake. If you're sitting around lackadaisical sedentary, your body, the oxygen that goes in through your lungs that's taken up by the red blood cells, it goes at a certain rate. When you exercise, you're exercising the heart muscle, the blood flow is going through the lungs better, you're getting better uptake of oxygen. It increases your muscle strength, obviously. If you lift weights, if you do push-ups, if you do pull-ups, if you do squats, you're improving muscle strength you with weight training and resistance. That's just a few. I can tell you there's over 50. It helps preserve your lean body mass because it builds muscle. It reduces the risk of developing high blood pressure, increases the elasticity of the arteries. So the rigidness of the arteries come about from not exercising. You get calcium buildup. And if you're not expanding that artery with blood flow rushing through, it's going to get stiff. So when you exercise and you're breathing heavy and you've just had a good workout, you are improving your cardiovascular function. It improves the circulation to the coronary heart circulation, because as your heart rate goes up, you have to supply more blood flow to the heart. Let's talk about cholesterol. Your good cholesterol is called the HDL. That goes up. You want that up because this is what's going to form a lot of the hormones in the body. The bad cholesterol, LDL, it brings that down. So exercise helps your cholesterol panel. It sharpens your vision. Your vision is controlled by the retina in the back of the eye. And the retina has small blood vessels. When people have diabetes, it affects those smaller blood vessels. If they have high cholesterol, it affects those blood vessels. If they have high blood pressure, it's going to affect that. So when you're exercising, you're rushing that blood through, you're creating good flow to the eyes, and you get better vision. It also reduces your chances of getting glaucoma. It reduces the risk of type 2 diabetes. We know that because if you keep your body weight down and you don't eat a lot of sugar, your chances of getting type 2 diabetes is slim. You don't want that. People who don't exercise, people who gain excessive body weight will develop diabetes sooner or later. For smokers, people who smoke, I used to do marathons and half marathons, and I know there were some people smoked and they would run all those distances. But smokers who exercise have less risk of cancer than people who smoke and don't exercise. So exercise has a protective effect that even when you're doing a bad habit, it's protecting you somewhat. It slows the rate of your joint deterioration, which is osteoarthritis, because it strengthens the ligaments and the bones and the tendons around that joint. So if you're not doing anything, then, and you just have your weight on the joint, it's going to wear that joint out. That's why they always recommend physical therapy when you have arthritis, because you're strengthening the ligaments and the tendons around that joint. That takes pressure off the joints. That's why you want to exercise. Now, people who exercise, athletes and people who are just, whether they're runners or they're cyclists or they play basketball or whatever, tennis, people who exercise have an enhanced sexual desire and perform better. You have to be in good shape to perform well, okay? It's like any other activity. If you're in bad shape, you're not going to perform well. Exercise gives you better sleep, better relaxation. Exercise reduces your risk of cancer of the breast, of the prostate, and the colon. Because as I started out, I told you that exercise helps with your immune system. When you have a sharp immune system, as soon as these growth appears, one or two cells that go awry and decide that they're going to start a cancer, the immune system will identify those cells early on and get rid of it. You know, I've heard a professor say once at one of my conferences that we're forming cancer cells every day. And it's just our immune system, if it's not up to par, it's going to miss it. So our immune system is keeping us healthy throughout the day, throughout the night. You know, you look at it as a surveillance, like you have an army of soldiers out there just swimming through the blood, looking for things that gone awry so that it can be attacked. It reduces the risk of stroke because obviously it reduces blood pressure. It helps with depression. I mentioned mood, improves mood. It helps to alleviate back pain. The most common reason for a lower back pain is an increased abdominal girth. If your belly is large from either fat or air or gas, and putting that strain on your back to keep you erect, then if you lose that belly, your back pain is going to get better, along with some chiropractic care, of course. Exercise improves your mood. It improves the mental alertness and your reaction time. It improves your appearance. Now, everybody wants to look good, right? Everybody wants to look good in their clothes. The last thing you want to do is to put on some clothes and then, everything is busting out, coming from your belly's sticking out, or you have tissue where you don't want it. Let's put it that way. So your clothes don't fit good on you. All right. So it definitely helps your physical appearance. It decreases your heart rate. If you believe the theory that we have so many heartbeats, right? When someone is in good shape, do they have a high heart rate or a low heart rate? Most people in good shape have a lower heart rate. Normal heart rate is between 60 and 100. If you're running around and your heart rate is a 90 or even the mid 80s, even though it's a normal heart rate, your heart rate is you're beating more heartbeats, right? And what it's saying here is that if we have a limited amount of heartbeats, you're basically using them up. So you want to exercise to get that heart rate down more in the 60s or the low 70s. Some people, like marathoners, will walk around with heart rates in the 40s because when they're not exercising, their cardiac output is so much better. They don't need to have a fast heart rate to get the blood flow to the tissues. And we know about relaxation. So I'm not done. People get constipated. They don't drink enough water. When you exercise, you move things along in your gut. You get better gut function, better blood flow to the gut. The gut can have that peristalsis activity, which is that squeezing. Things got to be propelled along. From the time it hits the stomach, the intestines is absorbing, digesting, and moving things along. When you exercise, you have better gut function. Here's what I like. Hey, your productivity at work. When you have more energy, you can produce more. You're not walking around dragging. At the end of the day, you're like dead because you have no energy. Improving your energy levels. Exercise does that. That goes along with good sleep too. But you will sleep better when you exercise, as stated previously. When you exercise, your balance, your coordination also improves. Your core strength improves. You definitely reduce your risk of getting osteoporosis, which is weak and porous bones that happen usually to postmenopausal women and people on steroids. Exercise increases the bone density. Exercise increases your general mood. You get better brain circulation. It gives you more energy and vigor. It increases your overall health awareness, and it improves your overall quality of life. I used to say a lot of times to my patients, I would say, if you could take a pill that would reduce your blood pressure, reduce your blood sugar, reduce your cholesterol, improve your mood, improve your memory, improve your performance in bed, helps with relaxation, anxiety, and depression. One pill. Would you get that pill? And 100% of people say, hell yeah. They didn't just say, yeah, they said, of course, hell yeah. And so that pill is exercise, and it's free. Doesn't cost you anything, maybe a pair of sneakers, right? So it's all about living a healthy lifestyle, and exercise is a key component of that. Okay, so I'm going to stop and see if you guys have any questions about what I said, and then I'm going to tell you how to design your own exercise program. Okay, so let's take a break to ask any questions. I see one comment in the chat. Charlene has been having a hard time signing on. Can you hear me now, Charlene? No, she's still trying to sign on. I don't know what's going on with her computer. But for the rest of you guys, anybody have any questions about the benefits of exercise? Anything about what I've just said over the last 4 slides? Any comments?
So, if you were diagnosed with high blood pressure
Mm-hmm.
and it runs 140 over 80 something, exercise will bring it down.
Absolutely. It depends. Now, if you have high blood pressure, I wouldn't want you to just go and say, okay, I'm going to run a marathon. I would tell you first to walk. I would tell you to walk briskly, get your heart rate up at least
Okay.
points. So if you walk for about 20 minutes to 30 minutes briskly, and you're consistent with it, yes, it will
Okay.
get your blood pressure down. I used to have high blood pressure when I was in my 30s. I was working in corporate America. I was working for Cigna Healthcare in North Carolina. And then I got into cycling and I dropped the excess pounds that I had on at the time. And my blood pressure went down and has been normal, because since that time is when I had my lifestyle change. I was about 37 and my pressure has remained normal. I'm a bigger guy. I'm 6'1". So my pressure is not going to be 110 or 120. It's going to be more like 128, 130. And when I don't exercise, my pressure goes up. So I use exercise as my pill that does all of that. It helps my blood pressure. It helps my blood sugar. It helps my cholesterol. And most important for me, it helps my mood and how I manage stress. If I didn't do it, I would not be able to handle stress, the amount of stress that I have running a medical practice and having a whole lot of stuff going on in my life. And I don't take any pills. I just take supplements. I take no drugs. Yeah, it's the wonder medicine, but we don't do it. We've become sedentary. Thanks for that question. Any other questions before I move on into what you have to do to design your program? Is that a no? Nobody has anything else to say about exercise before I get into this? Okay. I know you guys probably don't want to hear much about it, but it's a wonder drug. It is one drug. So when you first start to exercise, you want to warm up, and this should be at least for 5 minutes. You got to get your body ready to burn calories, get your muscles ready to move. If you don't, then that's when you run the risk of injury. Because if your muscles are tight and you decide you're just going to go and run, you got to really warm up, right? Low impact aerobic activity for 5 to 10 minutes improves the circulation and loosens the muscles. So our body initiates biochemical release to put us in a sympathetic state. Sympathetic state means fight or flight, right? So it's like you're telling your body, okay, I'm getting ready my heart rate's going to have to get up. I'm going to probably sweat a bit. So that's what the warm up is. It's just getting the body, not shocking the body. It's just saying, okay, I'm getting ready to do this. Get your brakes on, loosen me up. That's what the warm-up is supposed to do. So, some people will do some stretching, they'll do some jumping jacks, or they'll just walk in place, anything to increase the circulation for this particular time. 5 minutes. Always do that before you work out. Then, people will stretch. You don't want to stretch a muscle when it's cold. You want to warm up first. So this is when the muscle is stretched. This is how it looks. When it's relaxed, it's like this. And when it's contracted, it's like this. Muscle fibers can contract in a more stable manner, resulting in better utilization of strength when it's stressed properly. So some days, if I go to the gym and I don't stretch, I feel weaker when I'm trying to do my reps. So stretching improves this circulation to the muscle. You warm those muscles up, they become more pliable, and they're able to contract and relax better. You should stretch daily. You should, but if you do it right before you work out, say you're only working out 3 days a week to start, that's what I recommend. And then you want to slowly increase that up to 6 days a week. All right, so that's the benefit of warming up and stretching. Now let's get into what are the different types of exercise. You have aerobic exercise. Aerobic stands for the fact that you're going to be using air, oxygen. So oxygen is the preferred fuel. So when you do that, you're actually burning fat. You're burning fat. When you do anaerobic, you're burning sugar. We all want to burn fat, right? We don't want to burn carbs so much. We want to burn fat. So brisk walking, a light jog, stationary cycling or outside cycling, the elliptical, the rowing machine, which is a total body workout. Or if you have none of those and you have stairs in your house, stair climb. You climb them up, you walk them down. You climb them up, you walk them down. So that is very important. I need to mute whoever is not muted, because they're making a lot of background noise here. Let's see what that is. That is. Okay, I got it. All right. So it's the key is the duration of how long you're doing it. I mentioned 20 to 30 minutes, but you should at least, at the bare minimum, do 15 minutes of aerobic activity. And your goal is to get to 30 minutes. For the athlete, they would want to do 45 minutes, an hour, of just cardio. They call this cardio, but it's aerobic. It's because the muscle that's being worked is not only the leg muscles, but you're doing it to work the heart muscle. You're strengthening the heart. Okay. So you'll hear people say aerobic, or they say cardio or cardiovascular activity. It's because it's focused not on building muscle, but on strengthening the heart and burning fat. Now, if you want to build muscle while you're doing aerobic, you can use light weights, like 3 to 5 pounds, either strapped to your ankles or held in your hand. As two-legged animals, we are the most well-equipped of our kind for distance running. The way our pelvis girdle is set up, It has a rotation that allows us to stride with ease so we can take these big steps. Aerobic exercise is recommended for 30 minutes, at least 4 times a week, 3 times a week when you're just starting out. So things like arthritis, poor footwear, mentally are simple factors that contribute to so many limiting the daily exercise. Mental resistance, really, people who don't just have in their mind that, oh, I'm too old to exercise. Oh no, that's for kids. Oh, I'm too old for that. I'm old now. I'm not going to do it. Everybody should exercise. So now running, I don't recommend for people over the age of 50. Running, even though it's a good way of losing weight, it creates a lot of trauma on the joints because every time you take a step when you're running, not walking, but when you're running, your body is up in the air a little bit and then it comes down. And so your weight, say you're 200 pounds, you multiply that by 2. So each time you run, it's 400 pounds thin on your knees, on your ankles, on your hips. All of this can create trauma to the joints. So that's why I said walk or do things like the elliptical or a stationary bike or water aerobics. For people with arthritis or over 50, these are just as effective without causing trauma to the joints. Here's my lady friend here. Her name is Ida. She's 102 years old. And you see her number? She's number 19, and she's in a race. You're never too old. Now, she's small framed, and she's probably been that way a long time, but she's moving. If you don't use it, you lose it. So other examples of aerobic exercise: swimming, dancing. People like to do Zumba, boxing classes, jogging, don't recommend. Walking, I do recommend. Cycling, the elliptical, rowing machine, and stair climbing. These are all forms of aerobic. You want to do it between 15 and 30 minutes on most days of the week. Strengthens your heart. Okay, so now you've heard these terms. You may have heard them and not know what they mean, but this is HIIT, and this is HIIT. This is high intensity interval training, and this is high intensity continuous training. So you would see some people, they're walking on the street, right? Or they're in their workout clothes, and then they'll run. They'll run for a minute, and then they stop and walk. They walk for a minute or two. Then when they're rested, they run again for a minute. And then they stop and walk. That's high intensity interval, where you run as fast as you can, and then you walk or stop. You're still moving. That's a certain training that most bodybuilders will do because they're not long distance runners. They do that because they believe that HIIT was more effective of losing fat. But in 2017, a study showed that high intensity interval training was no more effective at weight loss than high intensity continuous training. What is high intensity continuous training? It's just like getting out there and just running and not stopping. But you're not running at full force. You're jogging. You're just taking your time, but you're not taking any breaks though. You're doing your 15, 20 minutes straight. It's just as effective at weight loss as the HIIT training. Because they always thought this was fast. Let me just run like mad, fast, as fast as I can for a minute, and then rest. So you know the terms now. One is called HIIT. This is interval training. And then you have HIIT, which is continuous training. Any questions on aerobic activity and HIIT training? You guys are following me? If I'm just talking, I don't hear any questions. I'm not sure if you guys are following what I'm saying. I still have you guys there, right?
I'm still here.
I see the numbers there. I'm just wondering.
I'm
It's either that or I'm just that good. I'm explaining it so that you guys have no questions.
and I'm taking notes.
Okay. All right. So cardiovascular training, aerobic training, same thing. You can do the continuous, you can do the hit. Um, they work primarily, they're strengthening the heart. Okay. Your legs have to move, so it's helping your legs with the blood flow, but it's really more for the heart. That's that major muscle in the body. So now let's talk about strength training. That's when you're strengthening your triceps, your biceps, your forearms, your thighs, and you're trying to get tone to it, your buttocks, your legs, your core. To build muscle, to improve your strength, you need resistance. Resistance can be either in the form of your body weight, like if you're doing a push-up, you can build up your chest, you can build up your biceps, your triceps with push-ups, because you're using your weight as a resistance, versus taking 2 dumbbells and doing bicep curls. Same thing. It's all considered strength training. And you're doing it for tone, you're doing it for volume to improve the strength of your muscle and for looking more defined. And you know, I could tell you from a lot of my patients, you know, especially my African American patients, women in particular, they're like, "Oh no, I'm not going to lift weights. Why not?" They think that lifting weights, that's masculine. That's too masculine. I can't do that. But they can do push-ups. They can do squats. That's all weight training. Because I think muscles, a little bit of muscle, looks great on a woman when she has firm arms and a toned buttocks and a toned hamstrings and glutes and quads. You know, if you remember, guys, Michelle Obama, she had those arms that people talked about. You think she didn't have to lift weights? She did that. She created that toneness in her body by doing strength training. Okay. So you create resistance with either your weights, you can use weight machine, bands. You know, people who travel a lot, they use resistance bands and they can work out with them in their hotel. Even though now most hotels will have a small gym that you can go and get your groove on, or you can use your own body weight. Why we need strength training. Our body is constantly bearing weight simply due to gravity. This should be the premise of exercise for beginners. This should allow benefits from simple body weight exercise. It improves bone strength and density, bone density. It improvement of muscle tone, circulation. It enhanced sexual desire. My trainer, who I use regularly, he's a firm believer that, you know, most men will get in the gym. I'm going talking about men now, and they'll work their upper body, and they don't like to do leg work. But when you do legs, squats with weights, lunges, you actually increase your hormone levels, your testosterone levels. And so men who work out typically have a stronger sexual desire. Strength training helps with depression as well. So you see this little woman here, she has, these are probably 5-pound dumbbells. You don't need a lot of weight. You just need the resistance. So if you don't want to use weights, what can you do? You can do push-ups, and you don't have to push up your whole entire body. You can start out by on your knees and just push up your upper body, because you're working all that upper body from your deltoids down to the biceps, the forearm. All of that upper body is being utilized when you do push-ups. Pull-ups are much harder if you do it without assistance, but they have machines at the gym that you can do assisted pull-ups where it reduces your body weight so you don't have to pull up your entire body weight. You can use resistance bands, as I've said before, and then you can use free weights. So you're increasing the size of the muscle and the strength. Remember these two things. You're getting stronger and you're improving the size. Your lean body mass goes up when you build muscle. Your lean body mass goes up. Muscle is heavier than fat. You lose inches when you burn fat because fat takes up a lot more space than muscle. Your overall energy expenditure goes up the more muscle you have. You ever see some people, they're overweight, right? And um, they don't lift weights or they don't do any strength training. And then they'll come to you and tell me that, oh, I can't lose any weight because their metabolism is so slow. And then I throw in weight training or strength training, and then they start losing weight. Because if you don't have muscle, muscle utilize fat, it utilize energy. Fat just sits there unless you burn it. It doesn't need any nutrients. Muscles need nutrients. So if you ever wonder why certain people can eat more, and like bodybuilders, I mean, they eat 6 times a day and they're eating big meals because that muscle is demanding food. It says, feed me, feed me, feed me. And if you don't feed me, it goes away. You lose your muscle. Okay. And that's why they're usually on high protein diets. So as we age, what happens to our muscles? They get smaller. That's called sarcopenia. You lose muscle. Look at even the boxers and the football players. As they age, they lose all that muscle and it's replaced by fat. So when you stop because you think you're old, all you're doing is accelerating that aging process, and you're looking older because now your posture is different. You're softer. There is nothing wrong with lifting weights until you're 100 or doing strength training until you're 100. Nothing wrong with that. You guys know how old I am. I'm lifting weights almost every day because I know I like the benefit. I like what it does for my body. I like feeling strong. I don't want to feel wimpy. I want to feel strong. Just because I'm older doesn't mean I have to look old. Right. So the exercise program then, let's say you only have 30 minutes a day to exercise. I want you to warm up and stretch for 5 minutes, 15 minutes of cardio, aerobic activity, walking briskly. Obviously, you can go up on this as time gives you more time, and then 10 minutes of strength training. If you don't have weights, you can do assisted push-ups. You can do dips with your chair. You can do lunges for your lower body. You can do squats. You don't need a gym if you don't have the wherewithal to get to the gym. I like the different machines, so I go to a gym. But it can be done in the privacy of your home. Okay. Last week we talked about massage. I think once you start exercising, you're going to get sore. And I recommend weekly massages. If you can't get it weekly, then at least monthly, once a month. The massage increases the blood flow to the muscle and it helps you to recover from your workout. Not going to spend much time on in depth. Chiropractic, Dr. Waters on. That is also very important when you're exercising. Everybody should get adjustments. It adjusts the vertebrae and it keeps us aligned. It prevents pinched nerve, or it helps to heal pinched nerves. Studies show that supporting that chiropractic is good. It helps with your blood pressure. It helps to prevent nerve compression causing sciatica and chronic neck and back pain. It helps with headaches and dizziness. I recommend chiropractic. If you can't get it weekly, at least monthly. When you see the chiropractor for an acute event, they'll have you coming in between 2 and 3 times a week until you're feeling better. But on a preventive basis, you should get it at least monthly. And these are some of the reasons why we need to have chiropractic adjustments. My favorite is that it reduces inflammation from the malalignment in our posture from sitting over a computer and having our necks bent forward. And when we free up the nerves, then our immune system is also boosted. So that's all the stuff that for physical activity that I want you guys to engage in. If you have any of these conditions, you should get checked out before you start any exercise program. Get your EKG. If you have coronary artery disease, you may want to get a stress test. If you have none of those, I think it's pretty safe to walk. But regular follow-up with your primary care, and I say regular, with no ailments at least twice a year, with one ailment 4 times a year, and with multiple ailments up to 12 times a year. Okay? Okay. I hope you guys learned something, and I hope you're going to engage in some exercise because you know how important it is right now. Right, Letitia?
Correct. I'm on my way to the gym now.
Wonderful.
Right, righto.
Um, Dr. Christie, might I add that we do have a variety of things that we recommend for exercise recovery. We have great magnesiums that really aid the body in recovering. And we have some things to help with endurance as well. Um, so stop by, consult Dr. Christie or myself for those things to help you recover. We have nitric. There's at least 5 or 6 different things that you can use to help build and boost your endurance as you go through your work regimen. And I must say this, ladies, and I know just based off of the name list that I have here, that we are very busy ladies. So I had prior conversations with Dr. Christie, and you know, the provider minds go back and forth on what's the best time to do this or that. Well, getting it out of the way in the morning seems to be very beneficial. Now, I was one that would go after work just to relieve stress, right? And I still would encourage that. Here lies the thing with this very busy American lifestyle. You get inundated with being mom, being wife, being everything to everybody else. And then the exercise regimen can take a back seat. So I would encourage you, even though I love to sleep in, people know I work very hard as a consequence of, loving what I do and acting out my purpose. I have found that it is best to get it out of the way, and that may mean 5:30 in the morning, when I thought that, let me just sleep in and get the extra sleep, it's more beneficial for me to go early morning to make sure that I don't allow any other factors to get into the way. So I would encourage you to look at the timing of your exercise and be very reticent and cognizant of how these things come up throughout the day that stop us from our normative exercise regimens.
Very true. I think everyone here at Anwan knows that I get up every morning at 5 because my days are long too, everybody. And I find if I don't do that, that's all she wrote. If I don't get up and get it out of the way and prioritize it, and I said, okay, well, let me just do this. I was thinking of this things. Let me just get up and I'll get this computer work done. So I'll spend a half hour doing that. Next thing I know, oh, well, I got to be at the office at this particular time, and bam, it's gone, just like that. So when I wake up, it's like robotic. I just roll out of bed, go to the bathroom, brush my teeth, throw on my gym clothes, grab my coffee because I like to drink coffee before I work out because it gives me a charge and it wakes me up. And I just get it done. Get it done, spend an hour, come back, and then I can start my day. So I don't start my day, especially a work day, without getting my medicine. Right? That's my medicine. That's what's going to help me to fight the lions and the tigers and the bears.
Yeah.
That's what's going to help me with my mood. That's what's going to help me with my energy. So once I get it done, it's out, it's done. In the evening time, if I want to go out and have a glass of wine, I can, because I've already taken care of my body, right? Early. I knocked it out before I even addressed any of y'all concerns. I did it already.
Yeah.
So morning workouts, I strongly recommend. The earlier, the better, so you don't miss out on the fun of everything else that's going to consume your time. All right. Gwen is back, I guess. Gwen, you people are here, but I'm not hearing anything from them. Any comments before we close out this session?
I need to hear something from someone because I know Miss Gwen is on a great exercise regimen. I had the pleasure to see several people. I'm not going to name you all, but I know that you all are looking well and feeling better. So please indulge
I
me
just
today.
hope I just hope I'm not intimidating anybody. Speak up.
I would say this, of course, is very informative, and it just gave confirmation that yes, because I schedule out for everything, and in the mornings I wake up every morning, whether I go to bed late or early. I always wake up at 5:30.
Yep.
Yeah.
There you go.
So I need to be intentional and get it out the way because first thing I'll do if I got emails overnight or appointments, I'll start working on the computer.
Exactly.
And
So
by
don't
the
even
time
look
I'm
at the
done in the
computer.
office, right?
Yeah, don't even look at the computer. It doesn't exist until you get your workout.
Yeah.
That's what I
Absolutely.
do. Seriously, because I've been trapped that way. You'll get a ding on your watch or something, or you
Oh,
pick up
yeah.
your cell phone and you'll see, oh, somebody left me a message, and oh, I should have to take care of that, and you go take care of that. Next thing you know, you're caught on that computer, and your workout
Right.
goes by the wayside. No. So, yeah, that's a excellent point, Dee.
I'm still tired a lot, Dr. Christie.
Is that Charlene?
It is.
Oh, I can hear you now. I've been trying to talk to you all hour.
Dr. Christie, it took me a half an hour to be able to hear you.
Well, what was going on with your computer? It wasn't it?
I,
What's
I
up?
don't know. I don't know.
Okay.
I don't know.
All right. Well, you came to see us. You need to continue with your your nutrients. I know you got
Mhm.
you got one IV, right? Maybe two. Um, your nutrition is probably it's either you're not sleeping or
I
your
sleep out.
nutrition
I
is
sleep
bad.
out. I sleep out. I'm tired all the time.
Yeah.
Well, we have to make sure. Did you get your thyroid checked and your other hormones yet?
No.
Okay,
So,
well, we'll have to do all of that because chronic fatigue, I mean, before we give you that diagnosis, we have to make sure we rule out everything that we can treat.
Mm-hmm.
Okay?
Okay. Okay.
and Miss Davis, I will be over in the area, Hapeville, tomorrow. By the way,
I'll
I
be
do
there.
have Saturday appointments in Hapeville as well. I'm gonna swing by the office. There's some things that I think may benefit you. I'll bring them with me. I'm not sure that I have them at the Hapeville location, but I'll see you sometime really soon. And then we can look at a few things that maybe we need to add.
Yeah,
Okay.
definitely
Okay.
NAD. NAD will help her with her
Yeah.
energy. All right.
Okay.
All right. It's 2 o'clock, and I normally go to 2:05 because I start at 1:05 because I get 5-minute grace. So, any other comments before I exit? Going once, going twice.
Oh, well, let me just look, let me get this in. As far as the resistance bands, ladies and gents, I don't know who all is on here. We'll
Yeah,
test the resistance bands. I have several types and flows, and we can look at when I do have the opportunity to see each and every one of you, which ones you can benefit from. And I think I have a few that I can lend. I make sure that you all have. Um, so I'd also like to say to Miss Gwen, your order is coming. So we'll make sure that you have what you need as well.
Thank you.
Uh,
And I have started walking, by the way. I'm walking 6 days a week, 4 miles in the morning.
Well, see, I
Yeah.
just needed you to say that.
I got on the train late. Well, I was just stubborn, actually. But I have started, and I feel so much better and less pain pills. And that was the goal, was to, reduce the pain pills, try to get some normalcy back into my life. And I gotta tell you, those 4 miles in the morning really does work.
Yeah, take control. But you see all the benefits. I don't know if you were here early on, Gwen, but I went through like 50 different things that exercise.
I did.
Yeah, so it is not just to build muscle. It's when you think of the brain part and what it does for the mood and what it does for anxiety and what it does for depression. I mean, that alone, and then what it does for your overall function, and it just, people are missing the boat when they're not exercising. If they say
Yeah.
time to exercise, there's a famous quote in one of my courses. It says, if you don't have time for exercise, then you have time for disease.
Yeah.
Yeah.
So
I was going to take this morning off. I'm like, okay, I'll walk these 5 days now. I'm taking today off. But I woke up this morning like, no, I'm going to do this because it actually,
makes you feel better.
it does. It makes
Yeah.
me feel really good when I get back in the house after that
Yeah.
long walk.
Yeah.
And then, if you're outside, which I would also encourage, because you become, one with nature, so to speak, but
Right.
you're getting your vitamin D. We are people of the sun. We need the sun. And it also is a way to clear your thoughts and commune with God, whomever
Mhm.
you deem that to be. But it gives you some aspects where you can, have some spiritual time, and you get your vitamin D,
Mhm.
and so you get like a threefer if you're outside with it.
Yep. That's the fact. Well, ladies, thanks. Next week is our last session. They will all be available on YouTube. So we're going to keep the program going for other participants. And I think at the last count, we had over 60 something. So, I've been adding people every now and then. People will come in on 1 or 2 a week. So they'll be able to go back and listen to the other talks and stay motivated. But thank you guys for listening. Thank you for your continual attendance, because I recognize the names. And it's good to be able to talk to you guys. It gives me great joy to do that. So you guys have a
Indeed.
blessed week.
Be well, everybody. Bye.
Bye-bye.